Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in our previous session, as we have started discussing about the process of urinary elimination, we've also discussed about the acts of urination, about the various types of specimen which we can collect for the diagnostic purpose. So in today's session, we are going to discuss about the guidelines that we must follow whenever we collect or transport the specimen from the place which it has been collected to the lab. Because here you might have seen that for some patients who are being hospitalized, they may be in their ward, and when the physician has advised that any urine specimen must be collected for any of the diagnostic tests, then they will be collecting it in the ward itself. So here, when a person is collecting, as well as after he or she have handed over the urine sample to you, now it is your responsibility to transport the urine sample from the ward to the lab. Here, when you are doing this, there are various guidelines that you must follow. So in order to get a clear idea, let us start with this small topic. As we know that the urine which will be collected must be free from any contamination. This urine which will be collected, or the specimen container which will be provided to the patient, must be free from any microorganisms, from any particles or any interfering substance, as well as it should be clean and sterile. This collection or the transport container must have a secure lid, as well as it must be leak proof, because if it is leak proof, then it will reduce the specimen loss. It will reduce the risk of the healthcare worker to be in contact with this specimen, as well as I've repeatedly been saying that it is very important that this specimen must be free from any microorganism. This specimen container has a secure lid, and if it has a leak proof, and if it is leak proof, then here it will prevent decontamination of the specimen as well. Which is why the use of containers which are made from break-resistant plastic is strongly recommended. The container material should also not leach the interfering substance into the specimen. And once the specimen containers had been provided to the patient, you should make sure that it should not be reused again. Suppose now if the specimen container was given to one patient, after you have collected the sample and handed over the container to you, if again for that particular person another urine sample must be collected, you should make sure that you do not use the same specimen container. Or even if the specimen of one person has been collected, then again you should not give that same container to the other person to collect the specimen. Which is why it is very important that after this specimen has been collected, it must be immediately sent to the lab, where various diagnostic tests depending on the physician order will be conducted. And once this is conducted, then the specimen container must be discarded. And again, this collection container or the specimen tube must also be compatible with the pneumatic tube system, where these are used for the urine specimen transport. And again, for this, you must make sure that you use a leak-proof container in this situation. These guidelines had also made a following recommendation for the process of urinary collection. Here, the first recommendation states that the guidelines had also made certain recommendations for the process of urinary collection. Here, the first one is that if a person or if the patient is advised to collect the primary or the routine specimen, then here we must make sure that we provide a container which has a wide base, as well as a capacity of at least 50 ml. If the 24-hour specimen must be collected, then here the 24-hour specimen container must have a capacity of at least 3 liters. If any specimen must be collected for the performance of any microbiology test, then here we must make sure that we provide the sterile collection container. And all these specimen containers which will be provided, be it the containers which we will be providing for collecting the primary or the routine specimen, the 24-hour specimen, or even for the microbiology specimen, here we must make sure that all these containers must have a secure lid in order to prevent the leakage of this specimen, and also to protect the specimen from getting contaminated. An amber color container can also be provided if the specimen which must be collected is required for the assay of light-sensitive analytes such as the urobilinogen as well as the porphyrins. These are few of the things that you must keep in mind before you provide the specimen container to the patient, because as we have seen that depending on the specimen which they need to collect, depending on the type of specimen which they need to collect, the container which we will be providing will be different. And also here, as I've said, that the container which you will be providing, you must make sure that it must have a secure lid as well as it must be leak proof, and also it must be compatible with the automated system as well as the instrument which will be used in the laboratory by the lab technician, so that the particular test which has been ordered by the physician can be done. So after the container which will be provided has been decided, then here it is also very important that you must label the container before you hand it over to the patient for the collection of the specimen. Here, if this collection container is used for transport, then this label must be placed on the container and not on the lid of the container, since the lid can be mistakenly placed on a different container. So here, as you can see in the picture, that this is what a specimen container is, and here as you have also seen in the picture that this label is being sticked to the container and not to the lid of the container. Why we do not stick it on the lid of the container? Because here, once this container has been sent to the lab, and when these lab technicians will be performing these tests, they need to open the container. And here, as we also know that it is not that just one sample will be tested in a day. There are large number of samples which they will need to test. So here, when these containers are being opened, the lid will be placed on the side because they will have to take the urine sample in order to perform the test which is required. So here sometimes there may be a confusion with the lid, whereas if this label is being stick to the container, then here there will be no confusion because they will be taking the sample from the container itself, which is why it is advisable that this label must not be sticked on the lid, especially if the collection container is used for transportation. We must also know that some labels may not be suitable to stick on the container if these container must be refrigerated, because here there may be a lack of adhesion at a low temperature. So here, once the test has been ordered by the physician, you will be getting an idea whether this test can be performed at once or whether this specimen which has been collected must first be refrigerated, or sometimes even it is advised that the patient must collect the specimen, and this specimen is collected not just to perform one test, but there are several tests to be performed, and in order for this to be done, this sample or this specimen must be refrigerated, right? Because we cannot keep the specimen outside. Any specimen which will be stored for the performance of various tests must be refrigerated. So here, if this container is refrigerated, then here we must make sure that we collect or we stick good label, a suitable label, because there are some labels which will not be suitable if this container is kept in the refrigerator because of a lack of adhesion at a low temperature. So you must keep this in mind for what is the sample collected, will it be refrigerated or not, and if it must be refrigerated, then you must make sure that label it with the label which will be suitable under the refrigerated condition. Then next is the volume. So here it is very important that the specimen which will be collected must be sufficient enough for the performance of a test which has been ordered by the physician. It is very important that the specimen collection personnel must make sure that the specimen which has been collected is sufficient enough for the performance of the required test. Because as we know that for the specimen in the preservative tube, it is very important that the fill volume must be correct, and also if there is presence of underfilling or overfilling, then these tubes can adversely affect the test result accuracy. So here is very important that once you hand over the specimen container to the patient to collect their specimen, you must make sure that you instruct them till where do they need to collect the specimen, so that this will be sufficient enough for the performance of the required test. And by this, it will also prevent the underfilling or overfilling, because if this occurs, then this tube can also adversely affect the test result accuracy. The next is the collection time and date. So here, as I've said, that you need to label the container before you provide it to the patient. So here you must make sure that you correctly label the time and date as well, because this will give a clear idea when was this urine collected, as well as at what point of time was it collected. Here, not only that, but this will also include the name of the patient. As we know that in this container, the name of the patient will be mentioned. So it is also very important that not just the name, but the date and the time of collection must also be labeled. And here, if it is for a time specimen, which is for a 24-hour urine specimen, then here you must also make sure that you clearly note down the start and the stop time of the collection. The time at which this specimen was received in the laboratory must also be documented for the verification of proper handling and transporting the specimen after it has been collected. The next is the collection method. So here in our previous session, as we have discussed about the various methods of how we can collect the urine specimen, so here it is very important that the method of collection of this specimen must be confirmed when the specimen is received in the laboratory, in order to ensure that the type of specimen which was collected as well as submitted meets the need of the required test. Because here, for example, if the patient is advised to collect the random specimen, instead of that, if he have given the fasting specimen, here if the desired test is being performed, there may be a difference in the value or in the result, and this will not give us an accurate result, because here this test has been ordered to perform by collecting the random specimen, but if instead of this another specimen has been given, then it will not meet the requirement of the desired test. So this is why it is very important that as soon as this specimen is being collected and submitted to the lab, they must make sure that they confirm the method of specimen, so that it will be able to meet the requirements of the desired test. The next is the specimen preservation. So here, as I've said, that as soon as the specimen is collected, you must make sure that you immediately send it to the lab. So here, if the specimen is not received within the 2 hours of collection, then the specimen reception personnel must confirm that a tube containing an appropriate preservative has been used, and also here the confirmation of an appropriate preservative has been used, and also here the confirmation that the specimen is received within the allowable time for the particular preservative tube use is also required. Here it is very important that as soon as the specimen has been collected, it must be immediately sent to the lab. And here, if this specimen which was collected is not received within the 2 hours of collection, then here the specimen reception person must make sure that she confirm that this tube containing an appropriate preservative within the 2 hours of collection. Then here the specimen reception personnel must confirm that this tube or container containing an appropriate preservation has been used. The last one is the light protection. So here, any specimen which has been submitted for testing of light-sensitive analytes must be collected in those containers that protect the specimen from the light, because here from the name itself you can understand light protection. So here, for the collection of the specimen which requires the testing of the light-sensitive analytes, we must make sure that we provide a container that protects that particular specimen from light. So these are the various guidelines that you must follow. So now we have come to the end of this topic, whereby in today's session we have discussed about a very small topic, yet a very important one, which is the guidelines for the collection and transportation of urine. So I hope you have got a clear idea of what are the various guidelines you must follow, and why is it important for you to choose the right specimen container before you provide it to the patient, depending on the type of specimen that he he or she must collect, as well as I hope you've got a clear idea that before you provide this container, you must make sure that you label it, you must make sure that you explain the required volume of the urine which must be collected, as well as you must make sure that you note down the name, the date, as well as the time of when the specimen was collected. You must make sure that you also explain to them what method is required for the collection of this specimen depending on the test which has been ordered by the physician, as well as the importance of immediately sending this specimen after it has been collected. Hope you have got a clear understanding of this topic. I'll be meeting you in my next session. Until then, have a good day. Thank you.